Thank you everybody for joining us for today's Health Insurance Town Hall number 3. I'm excited to have Sheehan back with us today to be our expert. He is a senior policy analyst from the Department of Vermont Health Access. My name is Zack Goss. I also work for the Department of Vermont Health Access and work a lot on these communication exercises and initiatives to try and get important health information out to you and our important Vermont stakeholders. Today will be again the third of a series of 6 town halls, and it's an opportunity for us to share some of the exciting opportunities that are now available through Vermont Health Connect, Vermont's health insurance marketplace, and a lot of the new policies that have been implemented in the past several months. We do a couple housekeeping items. We do have a question and answer box on the screen, and that is the way that you can interact with us and ask questions. We want to allow for a lot of time for you to ask us questions, ask our expert who's here with us today the questions that you have. So please feel free to write those questions and send them in as they come up to you, and we will take them. We will try to get to all of them by the end of our hour-long meeting today. So without further ado, Sean, welcome. Let me bring you on the screen here, and thanks for joining us.
Yeah, thanks, Zach. Thanks for coordinating this town hall again, and thanks for folks who are joining us, taking time out in the summer to learn about health insurance. I know that may not seem like the most exciting thing, but you know, in fact, the health insurance landscape changing the way it is and making health insurance more attainable for many more Americans, many more Vermonters is something that's excited to talk about and to spread the word about and answer questions. So happy to be here and happy to have folks join us. Just to get started with the last health insurance town hall, we did a little warm-up quiz at the beginning of it. I didn't get any hate mail for that, so, and I like quizzes, so if you have feedback on how today's town hall goes, let us know. We'll incorporate it for the future ones. But until we hear otherwise, I'll start with some quiz questions here to warm up. So fortunately, we don't have the mechanism for everybody to instant poll or shout out the answers, but if you think about your answer yourself, for this, how much money can a single Vermonter earn and still qualify for a plan with a $0 monthly premium? So for folks who are new to health insurance, the premium is what you pay each month just to have your health insurance. So by paying that premium, that's your monthly bill. It's the same every month, whether you have to use a lot of medical services or don't use any. This keeps the insurance for you. You get things like preventive care, and you have the ability to have that peace of mind that knowing that you're protected from other, not having the bank broken if you do need to use coverage or have a surprise. So this is the monthly bill, and these are the options. We don't know how many people guessed 31,600. If you guessed that, and we had done this quiz, what, six months ago, you would have been right. Before the American Rescue Plan, people with incomes up to 31,600 could find some health plans that they didn't have to pay anything for on a monthly basis. They might have out-of-pocket costs, but that monthly premium would be zero. If you guessed 38,280, congratulations, you're correct. That's about 3 times the federal poverty level, and under the American Rescue Plan, individuals will be able to find those plans that would have $0 monthly premium. If you guessed 51,720, sorry, you weren't right on that. If we had phrased the question a little bit different and asked how much a couple can earn and still qualify for a plan. So if you and your spouse both needed insurance together, you earned $50,000, you'd be able to get a couple plan with no monthly premium. The second question number 2, before the American Rescue Plan, the lowest cost plan on Vermont Health Connect for a family of 3 earning $100,000 a year was $1,381 per month. How much would that plan cost them today? And these are the options here. People think of their options. Give you a minute. And yes, before the American Rescue Plan, that was quite expensive. This is people who fell on the high side of what we call the subsidy cliff. People earning up to 4 times the federal poverty level would be protected, would get substantial subsidies to lower the cost of insurance. But if you were over 4 times the federal poverty level, as $100,000 income would be for a family of 3, you weren't protected and had to pay full cost, which could be quite substantial. So for how many people guessed $170 per month? Unfortunately, that's not right. If this question had read 4-person household earning $100,000, that's what they would pay. But a 3-person household, the correct answer is $208 per month. That might strike you as a little off. Why could a family of 4 get it for less than a family of 3? And the reason is that the federal subsidies, the way it works under the Affordable Care Act and the American Rescue Plan, comes down to what they deem a family's ability to pay would be. And because the federal poverty level is tied to the household size, when you think about it, $100,000 would go a lot further in a 1-person household than, say, a 5-person household. The way it's calibrated that way is why a 4-person household with the same dollar value would be able to get that for $170 a month rather than $208 that the family of 3 could have. $708 per month, that's actually what the second lowest cost silver plan was. If you people who are kind of active and compare plans a lot, maybe follow the news, you might hear a lot about that. That second lowest cost silver plan is a benchmark plan. And for people with relatively higher incomes, people who previously were unsubsidized, you'll hear that this second lowest cost silver plan they can get for 8.5% of their household income. So that nearly $1,400 a month before, that would have been way over 10% of their household income. $708 would be 8.5% of their income. And for people who might be uninsured, but thinking, 8.5% of my income is still a lot. It's important to know it's just for that benchmark plan. There are plans available. For example, this lowest cost bronze plan that would be significantly less than 8.5%. As you can see, for this particular example, that plan would be about 3% of their household income. Now, those lower cost plans are going to be more likely to have out-of-pocket costs. So we're going to talk about choosing a plan here momentarily, but it's something to put out there that it's significantly different. The fact that this household before couldn't get a plan for, find any plan that would have been less than 10% of their income, and now they can get it for for less than 3%. Going through here, the other options we had, $720 per month. That's actually what this household could get a gold plan for. And this is notable too, as you'll see, people who they could get that silver plan for $708, or they get a gold plan for $720. And this is kind of a fork in the road that people would be able to get that gold plan. All metal levels, we should say, whether they be bronze, silver, gold, platinum, they're all exactly the same in the services, the essential health benefits that they cover, being able to get preventive care with no out-of-pocket costs, being able to have hospital visits, emergency room, pregnancy, physical therapy, a whole variety of essential health benefits. They're the exact same, whether you're in bronze or whether you're in platinum. the differences in how you pay out of pocket. And in general, without additional subsidies, a silver plan, about 30% of the cost of your coverage, covered services you would pay out of pocket. The insurance company would pay 70%. For gold, you'd pay about 20%, and the insurance company would pay about 80%. So for somebody at this income level who isn't getting other subsidies, that difference between the 708 and 720 and having much lower out-of-pocket costs with that gold plan would mean that gold plan oftentimes would have a lowest total costs. And our plan comparison tool at vermonthealthconnect.gov can help people compare all of those plans. The $1,070 per month, that's what they could get a platinum plan for. And so platinum plan, you're only gonna have to pay 10% of your costs of services out of pocket, but that's obviously a lot of money you're paying for the premium there. It's granted you can get that platinum plan for less. This household, they can get that platinum plan for less than they could have gotten a bronze plan for earlier in the year because they're applying those new subsidies across, but it's still a significant premium. One final question, and then we'll jump into the meat of today is we kind of, from that, based on that last question, you might be thinking, okay, why would anyone get a silver plan? It seems like gold or bronze are the way to go. Maybe bronze if you were thinking about being uninsured or really don't want to spend much money on the premium, and a gold plan if you want the lower out-of-pocket costs, premium not being much different. So the question is like, well, why would somebody want to enroll in a silver plan? And the plan comparison tool may be the best way to see for your own case, but a few options we'll put out here to drive home. Number one, you're allergic to gold. It's actually not a joke. I think about 10% of the population is allergic to gold, but you don't have to worry about it with the gold plans. There's no actual gold in them. No allergies there. Number two, if you don't qualify for subsidies, so this last example we gave, is that somebody should enroll in a silver plan. And three, anybody who guessed if you qualify for silver 87 or silver 94. That was the correct answer. That might not make sense what silver 87 or silver 94 is. We'll get to that in a minute. There's also silver 73 and silver 77 are additional subsidies. But really silver 87 and silver 94. If you go through the plan comparison tool, you'll enter information about yourself, about your household, ages, what the household income is. It's an anonymous browse. We don't get the data. You don't have to enter any personal information. And if you were an individual making $25,000, for example, you would then click the button to see what your subsidies are. You would see these two numbers here, the $662 and the silver 87. They refer to two different types of subsidies. The premium subsidy, that's $662 per month, means as long as you enroll through Vermont Health Connect, you can take any plan and it'll cost you $662 less per month than the full cost. The enhanced silver with cost sharing reductions means this is what you'll have to pay if you get a silver plan on average out of pocket is about 13%, with the insurance company paying 87%. And this is significant here, because you'll remember that we talked about, in general, unsubsidized silver plans are about 70% the insurance company pays, leaving the individual to pay to pay 30%. And so if you can just pay 13%, but have that relatively lower premium, silver is going to be a better deal than gold or platinum. And in the case of bronze, it used to be that people may want to go to a bronze plan because they didn't want to pay more for this enhanced silver plan, even though it would have very low out-of-pocket costs. But as you can see now with the additional benefits from the American Rescue Plan, it's not much different, at least for folks who are qualifying for Silver 94 and Silver 87. It means that their premium subsidy will be substantial as well. In this case, people could get a bronze plan for $0 per month, but they could also get a silver plan for as low as $4 per month. So for that extra $4 to have very, very low out-of-pocket costs compared to potentially high out-of-pocket costs with the bronze plan makes the metal level decision easier if you're seeing this Silver 87 or Silver 94. You can still get a variety of silver plans from either Blue Cross or MVP, but it makes it a good way to go. If you see something different there, if it doesn't say Silver 87 or Silver 94, if it says Silver 73 or Silver 77, or doesn't say anything, then you're going to want to dive deeper into the plan comparison tool, and let's say any metal level might be fair game. And I think just the last piece before we jump into the questions is just for people who haven't been to the homepage before, vermonthealthconnect.gov. Want to just point out 3 links. This one I've been talking about. You see that shopping cart where it says plan comparison tool. You click on that shopping cart, it'll walk you right through for your particular household situation. Number of people in a household, their ages, your income, and so forth. It'll show you what subsidies you'll qualify for, and what plan might be the best match for you. Number 2, you'll see this link to the American Rescue Plan Act. If you click on that, you'll go to some frequently asked questions talking about different situations, whether you're direct enrolled with an insurance company, showing you how you can come over to Vermont Health Connect and start getting those subsidies. If you don't have insurance, talking about how you can sign up between now and October 1st, start taking advantage of the protection that health insurance brings and these new lower costs. Or if you're already a member, largely we're talking about today, it'll show you how you can apply your new subsidies as a bigger discount on your bill, and how, at least for this week, for August 15th, you can change to a different plan. Still, as long as you stay with the same insurance company, have your anything you've paid toward your deductible carry over, and be able to have those potentially lower costs like we're talking about there with silver or other metal level. And then third, how to get help. If you want to talk to somebody on the phone, our call center's open 8 to 4:30 every day, Monday to Friday. Also, we have our sister organizations. Zach, you may be the best spot to say a word about the assisters.
Sure, I'd be happy to. So the assister organization, the assister program is a group of different types of offices and organizations around the state that employ folks who can actually help you in person, or in some cases virtually, with your application or the maintenance of your health insurance. So the best way to identify them, if you'd like this help, and they can be a huge resource for just getting a better understanding about all these different things that Sean's talking about, and just general health insurance information, is to go to our website and go to the in-person assister page, and go to the directory and look for an organization that you may be familiar with, maybe you're a current customer or patient at, and give them a call to set up an appointment. Many of them can take appointments very quickly, and again, sometimes virtually at this point in time. So now is a good time to call them. You know, it's better to give them a little bit of runway so that they have some time to set up the appointment before any deadlines happen. And I know we'll talk more about all the deadlines that are coming up, but they'll know all those deadlines that you need to make all your changes and make all your enrollments by. So they're a great resource. Sean, anything else before we jump into questions?
No, that's great, Zach. I'll just call it. I guess we mentioned the phone and the in-person. Just the last one we'll mention, the online. You see there, right there in the lower right. If you're already a a member and have an online account, and you want to do this at 11 at night instead of during the day, you can log right in, change the amount of the subsidy you're applying as a discount on your bill, or this week change plans as well if you've looked at the plan comparison. So the online accounts are a great self-serve option too. But yeah, let's jump right into the questions.
Great. And Sean, one thing that I wanted to mention too about the Assister program is if you have trouble going online, or if you are unable to go online, you can always call our customer support center and they can help connect you directly to an Assister. So not to hesitate there. There's multiple ways to identify one. So, all right, so let's see here. So our first question is, would utilizing these tax credits affect my eligibility for my employer paid QSEHRA program? If so, how would I calculate the cost benefit of taking the tax credits versus the HRA?
Yeah, that's
a piece to that, but I'll let you take it, Sean.
Yeah, that's a great question with the HRA, and I think for questions around HRAs and what the impact would be on the taxes, it can be a little complex, and so I encourage you to talk to your employer's HR department or to a tax preparer. But the short answer is, in general, these tax credits that you get now are by virtue of your income and what the new law entails. They changed what the subsidies were before. So people who are entitled to those subsidies are entitled to those subsidies, and the premium tax credit you'll get is the premium tax credit you'll get, whether you opt to take it in advance or whether you don't take it now as a discount on your bill and you take it when you file your taxes. It would be the same either way. It's kind of like, I think right now the summer has been more press given to the federal child tax credit and how they're making that advanceable as well, and how people are being mailed the checks from the federal government for the kids they have. And if they don't want that, they can opt out of getting those checks in advance, meaning that they'll would be more likely to get a tax refund when they file their taxes next winter. But for those of us that are getting the checks, those child tax credits in the mail, that means we're less likely to have as big of a refund as we've gotten in past years, because the child tax credit, we would have used it during the year rather than getting it at tax time. But we end up with the same tax credit, and it's a similar idea here. So we've had about a quarter of Vermont Health Connect members so far opt to get their expanded tax credit as a discount on their bill. At the end of the winter, they'll be financially in the same place that they were. Now they just have this money for cash flow this summer and fall. And so with the HRA, my understanding is the way those work, and the QSEHRA is where the employers contribute, but people don't lose their eligibility to buy a plan as an individual in the marketplace and to get tax credits. But you'll get less tax credits than you would if your employer wasn't contributing that HRA. And there's federal tax forms that kind of do those calculations for you. And so I think you'd want to look at that. And if you're getting that HRA, maybe you would only take a portion of the amount that you'd be found eligible for as a discount. Because if you're taking a full discount that somebody of your income level would get if they weren't getting that additional subsidy from their employer. Then they'll likely owe some money at tax time. But so if you went through those tax forms, saw what your subsidy would be, given the amount of the employer subsidy you're getting, you'd be able to safely take some of these tax credits in advance now, and still not take more than you'll be getting, to avoid having to pay money back when you file your taxes. Having said that, if that sounds too complicated and you'd rather just continue to pay the bill you've been paying and kind of know in the back of your mind that you're going to get a bigger refund this winter when you file your taxes, because you have these additional tax credits coming your way from the American Rescue Plan, but that you also, they'll be diminished a little bit because of the subsidy you're getting from your employer. That's certainly a choice people can make as well.
Thanks, Sean. And one of the things that I'm hearing you talk about that doesn't necessarily apply directly to the HRA question, but just the similarities to the new benefits and new subsidies available, is that there remains some flexibility for customers to either apply them to their premiums now on a monthly basis or get that lump sum at tax time, next year, so that's not changing really. That's similar to how they would have done it in the past.
Yep. Yeah, that's a great point, Zach. And I think for the person that asked this question, I guess that would be a question too, would be whether this is a new arrangement with your employer or whether they had been funding that HRA in the past. And if they've been doing it in the past, you probably have a sense of how it plays out at tax time, based on how much money how much of the subsidy you've applied as a discount during the year, and then how that's impacted your taxes. You're right, that part hasn't changed. And really the important point to emphasize too, is related to this question, Zach, is that people who are already enrolled in the marketplace, like you've done the step that you need to get the maximum amount of financial help you can get. So we're talking about, there's some questions about when you'll get it and whether it's better to take how much in advance as a discount versus wait to tax time. There's a lot of personal choices there, but by virtue of already having signed up through the marketplace, you're going to get the maximum tax credit one way or the other. And so this is really where we want to get the word out. And at this town hall, we are focusing on people who are current members. We're focusing on this deadline for this week, August 15th, for people who are members who want to change plans, potentially save more money. But I think at a high level, it's important to emphasize, by already being in the marketplace, you're getting the maximum help from this American Rescue Plan. It's really just a question of how you get it. For people who aren't enrolled through the marketplace now, if people who are enrolled directly through Blue Cross or through MVP, or if people that don't have health insurance, that they looked in the past and thought it was too expensive, those are the people we want to reach, because they're the people who aren't taking advantage of the American Rescue Plan and won't be taking advantage of it until they enroll. So the sooner they call and transfer their plan over to Vermont Health Connect, or if they're not covered, sign up for insurance, the sooner they will have that insurance, and the sooner they'll be taking advantage of these new federal subsidies.
Got it. So those will really be the people who are missing out on this potential for extra subsidies. That's a helpful clarification, Sean. So let's move to the next question, which is, will customers receive increased subsidies if they collect unemployment in 2022? So just to review, if you didn't join us for last town hall, we did talk a little bit about those individuals, those Vermonters who received unemployment compensation during the 2021 calendar year and how that impacted their potential subsidy amount for health insurance. So the question here is that going to continue? Is that kind of program going to continue in 2022? if they collect unemployment, you know, in 2022. So Sean, I'll send that one to you.
Great. Yep. Thanks, Zach. Yeah, the short answer is no. Yep. That provision of the American Rescue Plan is focused only on 2021. The other provisions that we've talked about, both larger subsidies for people who are already getting subsidies before based on their income, as well as that higher income threshold we talked about, the people who were previously couldn't get subsidies because they were their income was over 4 times the federal poverty level, and now they can get it with those much higher thresholds, up to $94,000 for somebody in a single plan, up to over $250,000. People in a family plan can now get subsidies. So those two provisions that are income related, those continue throughout the end of 2022. That other provision that this participant asked about, as far as the specific unemployment benefit, that's only for 2021. So it's a great question to clarify, and also good to know that really for this week is an important time for people who are in a household where any member of the household was eligible for unemployment compensation for at least 1 week out of 2021, whether or not they got any payment for it or not, as long as Vermont Department of Labor found them to be eligible for unemployment insurance, pandemic unemployment compensation, pandemic unemployment assistance, any of those programs out of Department of Labor. Anyone found eligible for at least 1 week qualifies for much larger subsidies for 2021 and are deemed to have a low income regardless of what their actual income is, meaning where we talked about before with that Silver 87 and Silver 94 benefit, somebody could have a 6-figure income, but if they got unemployment compensation in 2021, they can get that Silver 94 plan, have those Silver 94 plan options for $0 monthly premium. And again, the Silver 94 plan means on average only 6% of the medical services and prescriptions you seek is going to be your responsibility. The insurance company is going to pick up 94% of the tab. So that's the maximum financial help that's available, and people can get that for 2021 by virtue of having unemployment compensation in their household and changing to that Silver plan. But you can only change plans if you're already enrolled. You could only change plans till the end of this week. So that's important for folks to do. And as we just talked about, Zach, that's not a benefit that continues past this year.
Thanks, Sean. And this is probably obvious, but just to clarify, those folks also, so those, when we're talking about the folks who've received unemployment, they also must go through Vermont Health Connect to receive this benefit. Is that correct?
That's right. That's right. Yep. We've had some people who had been direct enrolled through Blue Cross or through MVP. Those companies have been sending out letters. MVP will be sending out emails to their members, letting them know about this benefit, letting them know they have to transfer their plan to Vermont Health Connect. So yeah, we've been having folks who had gotten some unemployment compensation and were direct enrolled with the issue where they weren't getting this extra benefit, but as soon as they transfer over into the marketplace and are in a Silver plan, they'll both have that very low cost premium and low out-of-pocket costs.
Great. And I know recap some of those important dates before the end of the town hall today. Just for those of you who may be joining, and if you missed the introduction on how to post a question, you can post a question in the Q&A chat box. That is the way we can hear what you are thinking and what you would like to ask us, and I can pose that directly to Sean here live. We're going to try and get to all the questions that we have in the queue today, and we're going to go to another question now that reads, can you get reimbursed for deductibles you have already paid in 2021? For
deductibles you've already paid in 2021, no, this benefit is is perspective. And I'm assuming what the person asking the question is asking is let's say they had signed up for a bronze plan during open enrollment last fall. They might have looked at the cost of a bronze plan. Maybe they were in the boat of folks we were talking about who could get a zero cost or close to zero cost bronze plan, but for a silver plan with these low out-of-pocket costs, they would have had to pay maybe $100 or more, and that could be a significant amount of money. They thought it was better to go into the bronze plan with the higher out-of-pocket costs. They might have paid a couple $1,000s earlier in the year toward their deductible, and then now they have the opportunity to change into a silver plan because they're seeing that with the additional subsidies they can get a silver plan with a premium of $0 or $10, $20, much lower than it would have been last year. They transfer into that silver plan. Now they're in a silver 87 or silver 94 plan. Maybe they have a $0 deductible. Maybe they have a deductible that's just a few $100. There's different options that are as low as $0. And they're asking, can they get that couple $1,000s they paid in their deductible reimbursed to them? And that's a piece that's with the insurance companies, but it's perspective, so they won't be able to reimburse that, sadly. But it does mean that if you had been in that plan that you contributed a couple $1,000s toward your deductible, the deductible was $8,000 or whatever it was, you still would have had to pay $5,000-6,000 more toward your deductible before you reached it, or before you reached your maximum out of pocket. Now, if you're in a plan that has a few $100 deductible and you've already paid a couple $1,000, that couple $1,000 you paid when you were in the bronze plan, that does transfer over, as long as you're going from a Blue Cross plan to a Blue Cross plan, or from an MVP plan to an MVP plan. That means you will have met your deductible. You won't have to pay anything more towards your deductible for the rest of the year. Same thing if you've met your maximum out of pocket. If the amount you paid for your maximum out of pocket under your old plan exceeds what the maximum out of pocket limit is for the new plan you've switched into, you won't have to pay anymore, but you won't get reimbursed for what you paid on your old plan.
Thanks, Sean. There's a lot of plans out there. There are 20-something plans right on the exchange, and I'm thinking about making these decisions could be daunting. I know that there are some tools that we have that can really help make this information a lot easier to understand and speak to some of the questions that our potential customers or current customers might have around how much each plan costs and what the deductibles are currently and what they might have when they choose a plan. Is there a place that you can direct us and kind of show us what this will all look like in front of us?
Sure, yeah, absolutely. I can show a couple screenshots here if you think that's a good time to show a little bit more about the plan comparison tool in depth here.
Yeah.
Great. Okay, so if you're on the homepage, as we're talking about vermonthealthconnect.gov, we had these 3 links we showed you before. That number 1, that shopping cart where it says plan comparison tool. If you click on that, you'll see, and actually this is probably a good point to point out as well, that to actually use the application to apply for insurance, you can't do it from an iPad or from a tablet or a phone. You have to do it from a computer, but the plan comparison tool itself actually works quite well with a phone. And so this screenshot I took from my phone. You'll see it has that plan comparison icon there. So even if you don't have access to a desktop or a laptop, you can do this from your phone, and then when you're ready to to sign up or change plans, if you can't go on to an online account from a computer, you can call and do it. But this comparison is easy to do. You just click on that plan comparison tool icon. There's a little video here if you want to see. It talks a little bit about those questions Zach was just talking about, some of the considerations for people when trying to decide between all these plans. One of the considerations is what insurance company. I'd say probably the three big ones are what insurance company, what metal level, and then what plan design within that metal level. So you can do some of the research on all three of these from here. We'll show you, and of course you can also call Blue Cross and MVP directly and ask them questions as well about their particular plans. But you can get a lot from the plan comparison tool here. Number one, you'll answer some questions about the age of the people. Now, this doesn't affect your monthly cost, your monthly premium. That's the same regardless of what age and other demographics you are. The only reason it's asked here is for considerations as far as how likely you are to have to use medical services. As you can imagine, somebody who's 27, might go the whole year without, will very likely go the whole year without needing any medical services beyond maybe an annual checkup or something that's going to be preventive care and isn't going to have any cost. Whereas somebody that's almost Medicare age, 60, 64, they probably have more appointments. They may have other conditions or procedures they know of. You can enter those in, and that will come into consideration when it's showing you what your possible out-of-pocket costs could be based on someone for your age and health condition. It'll ask you questions about is employer coverage available to people in the household, because if you can get a health insurance plan, so not the HRAs that we were talking about, but but actual health insurance from your employer, you probably won't be eligible for lower costs unless it would meet the federal definition of unaffordable coverage, which we can get into too. As we noted, it has that question here about unemployment benefits, because there's that bigger subsidy in 2021. And then it asked the household income. So we gave that example before of somebody who was earning $25,000 as an individual. And when you click here to see your estimated help paying for coverage, that's when you get to this screen we showed before. We noted that $662 per month means there's all the bronze plans cost less than that, so you get any bronze plan for $0. But notably, there's silver plans that cost within a few dollars of that, so you can get that enhanced silver plan. And when you see this silver 87, what you're going to find out is that when you click to show me the plans, that it will be a few ways you can sort it. Now, if you sort by premium, again, that's the monthly cost you pay every month, whether you use any insurance, need any medical services or not. You'll see these are $0 monthly premium. So that's appealing. It means in a good year, if you only use preventive care, you're paying nothing the whole year for insurance. But you'll see that in a bad year, that $8,400, that's what their maximum out of pocket is going to be. So we had a question before about deductible. This plan we're looking at this first one has a $6,200 medical deductible and a $1,000 drug deductible. The next one has an $8,400 deductible, the same as the maximum out of pocket. So those are potentially very high out of pocket costs. Not nearly as bad as the tens of thousands of dollars or hundreds of thousands of dollars you could get if you didn't have insurance and were diagnosed with cancer or other types of accidents. It's certainly better than not having insurance, but it's still considerable out-of-pocket costs. So when you kind of flip over then to look at a silver plan, and you can sort up here instead of sorting by premium. If you're concerned with what you're going to be paying, your total costs, meaning what you pay for your premium each month, plus your out-of-pocket when you use it, you can sort by cost in an average year. And you see that there are silver plans available for this person with a $25,000 income, cost less than $4 per month. And what they get for that $4, which add that $4 adding up to $45, in a good year, what they'll have paid if they only use preventive care, is instead of having that worst case scenario be $8,400, that worst case scenario is $3,200 in this case, and that average year is $615. As you can see, the next one down below has a high deductible health plan. The good premium is slightly more, $7 a month, so they're still paying less than $100 for the whole year in premiums, and their worst case scenario there is under $1,500, so just a whole lot more protection in that case. And so there's different options, different designs. You can sort, go up right up to the top, so you don't have to look at that on your own. You can sort for cost in a bad year. You'll see that that cost in a bad year is 1/6 of that zero premium plan we were looking at. And again, even if you're protected in that bad year scenario, and even in a good year, you only use preventive care, still costing you less than $90 for the whole year. Now, this is kind of at high level. If you have 5 minutes to spend, you can do this. Go to the plan comparison tool, find out this much. But if you have more time, you can click on any of those plan names that are in blue. That MVP, VT Plus, Silver 2, high deductible, Blue Cross Blue Shields, Vermont Select, CDHP is consumer directed health plan, same idea as a high deductible health plan. The question before about the person asking about the HRA, if you have an HRA or an HSA, and HSA being a health savings account, you can pair them with these high deductible health plans. Might dig right in. You can click on that blue words here, and it'll show you more in depth. You can see it has the doctor's directory and the drug list. So if you have particular prescription drugs someone in your household is taking, or if you want to see if your primary care doctor or specialist you see or in the plan's network, you can click right on that link. It'll take you right to the networks for Blue Cross or for MVP, and you can get those questions answered. So that's kind of a bit about the plan comparison tool, Zach. I don't know if there's other questions people want to jump in on, or you have other things you want to point out here as far as people doing their research and decision making. Again, I would second, just as you were talking about with the assisters. Zach would highly recommend if people take a few minutes to look at this, see what you can kind of understand, see how the numbers are, and if you still have some questions, don't hesitate to call Vermont Health Connect's Customer Support Center. Don't hesitate to call Blue Cross or MVP, ask them about their plans, and don't hesitate to reach out to an assister in your county either and set up an appointment.
Yeah, thanks, Sean. That was really helpful, and I think hopefully helpful to those on the line learning about how they can find out more information about the different plan options. We've got only a handful of minutes left, and we've got a couple questions that have come in. And I also want to make sure that we have time to just review some of those important dates that are coming up in the next month and a half or so. So let's just start with the questions. And I think that actually you may have partially answered these, Sean, but I think it's always never hurts to review. So if just enrolling in Vermont Health Connect, do full deductibles apply for the remaining months of the year, or are they prorated because we're only talking about 4 months left?
Yeah, that's a good question. Yeah, the deductibles are full deductibles. So I think the question on that too is, in general, when you change types of insurance markets, whether you're changing from, say you had COBRA insurance, and maybe it's foreshadowing what we'll talk about in a minute, and you're switching over to individual insurance, or if you had large group coverage and you change to a different employer and they're offering employer sponsored insurance as well, your deductibles are going to reset. That's the norm, and that's the case here too. Whether you're coming over from COBRA or coming over from not being insured for 2021, you'd have the starting from zero with the deductible you have, and it would be the listed deductible. And then when it resets, if you renew your plan, the plan year is the same as the calendar year, so that'll start over in January, and that will be your deductible for all of 2022 as well. So really, the two exceptions to deductibles resetting are when you are already in the marketplace and you're changing to a different plan because you had a special enrollment plan period that allows you to change plans. And this year, for these 2 months after the American Rescue Plan through the end of this week, you can change plans, and your deductible will carry over. Anything you paid toward your other plan, as long as you stay with the same insurance company, that carries over. So that's exception number one. Exception number two, as we talked about, if you're direct enrolled with an insurance company, you transfer that enrollment into the marketplace. That's not a plan change. It's not a market change. You just have the option in the individual market to either enroll through the insurance company or through the marketplace, Vermont Health Connect. So your subsidies will be, what you paid toward your deductible will be honored by your insurance company for that reason. But if you're outside of that, if you're starting new in the individual market, then your deductible starts from zero.
Thanks, Sean. And I'm excited to see the questions continuing to come in, and going to try and get to all of those in the short amount of time we have left. And also just want to throw out there, because it does relate to some of the questions that are coming in. We do have 3 more town halls, one on August 25th, one on September 15th, and one on September 29th. And we're going to get into a little bit about why we've chosen those dates and how they correspond to things that are happening with Vermont Health Connect. And maybe, Sean, just because we're short on time, you can kind of take all these questions in one and synthesize it, a response based on the important dates and these questions. So one question is, can you show how to accept increased subsidies if you are on a plan in the portal? And I think that's probably one that we're not going to be able to demonstrate today. It's something that we can certainly help you with if you call us or speak to an assister. It's possible that Sean may have a couple other comments on that. And then the last comment or question is, my wife and I currently have health insurance through American Rescue Plan Act for COBRA that is active until the end of December. Can we sign up for a plan through Vermont Health Connect now before our coverage ends through COBRA? So a lot to get in there in 3 minutes, Sean, but I will pass it back to you.
Sure, yeah, I can do that. And can you still see my screen here? If you,
I'm going to send it live right now.
Okay, great. So this is the question that the first person asked about from their online portal, from their online account. How do they apply their subsidies as a discount on their bill? And so the situation you'll see is that when you log on to your account, you'll be able to go to apply subsidies, and it'll ask how much APTC would this person like to apply? APTC stands for Advanced Payment of Premium Tax Credit. So you get this premium tax credit, as we talked about, regardless whether you take it now as a discount on your bill or at the end of the year when you file your taxes. If you wanted to pay the full cost premium now each month, you could click right here where it says none, that tab on the right. In that case, you would get really large, you'd get it all as a tax refund. On the other hand, if you want to take the maximum amount, you could click over here where it says all. Oops, that actually, this is the page before where it shows your eligibility. You can take to take those benefits or to change the plan is that select a plan option we were also talking about, which is as of the 15th. I didn't mean to click there though, where we said all. And as we talked about, I think the person who mentioned having an HRA, not wanting to take more subsidy than they would get because they're also getting their employer subsidy and not wanting to have to pay back on their taxes. Similarly, if somebody thinks they might be getting a raise this fall or have a higher income that they're paying taxes on, maybe you don't want to take, maybe if you could get $1,400 per month premium tax credit, maybe you want to take $1,100. You could change this number to $800, $700. Where it says sum, you can put in any amount you want. And you go down there and click confirm, and that will apply to your next month's bill. If you do it by the 15th of the month, it'll take effect on the next month's premium. If you wait till next week to do this, it would take effect on your October bill and so forth. So that was the one question. On the COBRA question, yeah, that's probably a great segue, Zach, to one of the town halls we'll be talking about in September. The short answer is yes. Even though you have COBRA coverage through December, the Fed's COBRA benefit under the American Rescue Plan, they're only paying that 100% of your COBRA costs through September. So it would be good to come over sometime in September. You could even come over, next week, I suppose. But September, actually, no, it's going to start the first of the month after. So you come over anytime from September 1st to October 1st, fill out the application. You'd be able to have your coverage through the marketplace start on October 1st. That way you will have gotten your full COBRA benefit with the feds paying 100% of it through September, and you'll have your marketplace coverage starting October 1st. So that's something it's perfectly okay to do, and we're going to be promoting that a lot in September and talking about it at our upcoming town halls.
Thanks, Sean. And I think one of the things, so just to recap and kind of end for today's town hall, we should just remind people that 8/25, so August 25th is, August 15th is the last day for people to change plans, right? So August 15th, which is this Sunday, and we recommend calling ahead of time to do that so that you can reach our customer support center that's open until Friday afternoon. And then we've also got the end of October being the end of the end of September being the end of the COVID special enrollment period, as well as the COBRA period. So Sean, anything else you want to say with that before signing us off for today?
Yep, no, I think that's it. Those are the key dates. And I think, like you said, is right on. I'm calling this week, particularly if you want to change plans. If you want to try doing it online, try in the next couple days. You can do it this weekend too, but better to try sooner. And then if you decide you want to call, you can still do it on Friday.
Excellent. Well, Sean, as usual, thank you very much for joining us today for the town hall. Again, our next town hall is August 25th, and it'll be at noon. You'll see the links on our website, the DIVA website, as well as on our social media posts. Thank you all for joining, and until next time.